Welcome and thanks for joining us. My name is Dr. Wally Smith, and I'm the Florence Neal Cooper Smith Professor of Sickle Cell Disease at Virginia Commonwealth University. Today, we're here to celebrate World Sickle Cell Awareness Day, designated by the United Nations, and we're here to celebrate recent progress in sickle cell disease, and I'm excited to share today's program with you. Sickle cell disease, or SCD, is an inherited blood disease that in the United States occurs in about 1 of every 365 Black or African American births. It also affects people of Hispanic, Mediterranean, and South Asian descent, so it's worldwide. In sub-Saharan Africa alone, more than 300,000 babies are born with sickle cell disease each year. This SCD community needs far more attention than it has received. In addition to having a disease that inflicts pain and suffering, these families have endured health disparities that have gone unrecognized, as well as a fragmented system of care that does not always meet their acute healthcare needs. But today, we're here to celebrate. Today, we reflect and celebrate meaningful steps forward in bringing attention to sickle cell disease from the American Society of Hematology and others in recent years. I'm here today because I and others are part of a new generation of scientists and clinicians bringing sickle cell disease to life. And that just happens to be the title of a new series of podcasts I'm moderating for ASH called Bringing Sickle Cell Disease to Life. Now, I'm joined by Drs. Russell Ware and Dr. Titilope Fashipe. Please briefly introduce yourselves, doctors.
Hello, I'm Dr. Russell Ware. I'm a pediatric hematologist at Cincinnati Children's Hospital. I am the director of the Division of Hematology here at Cincinnati Children's and also the director of the Global Health Center. I'm delighted to be here with you today and join the celebration.
Hello, I'm Dr. Titilope Fashipe. I'm a pediatric hematologist in Houston, Texas, and I'm the co-director of the Sickle Cell Disease and Thalassemia Program at Texas Children's Hospital. I'm delighted to be here today celebrating World Sickle Cell Day with these distinguished gentlemen.
Dr. Ware, 6 years ago, when ASH launched its sickle cell disease initiative, there was one FDA-approved medicine for sickle cell disease. Now there are 4. What are some other advances that you've seen in the past few years that you want to tell us about?
Well, thanks for that question. It is exciting to see the acceleration in the treatment of sickle cell disease. But as a pediatric hematologist, I have to correct you. 6 years ago, there were 0 drugs approved for children with sickle cell disease. It was only in the last few years that hydroxyurea was approved, and the other new medications are not yet approved for children. So we're still lagging behind. I think 2 decades ago, the biggest advance that hit the sickle cell world was the advent of TCD screening. Instead of having children suffering from strokes and not being able to do anything about it, we suddenly had a way to intervene, to screen, to anticipate, and to act. A decade later, we were starting to use more hydroxyurea. And when the Baby Hug trial was finally published, we saw that it was both safe and effective. That really was a game changer too. And now in the current decade, we have so much new basic science. We're understanding so much more at the cellular and genetic levels that I think we're going to have targeted therapies emerge for years to come. So there's been a lot of advances. They may seem slow, they may seem incremental, but I think when you take the long view, they're really exciting. And I think we're going to see a big change in the coming years for the treatment and management of sickle cell disease.
Dr. Fashipe, do you agree?
I completely agree with Dr. Ware. You know, I have a unique perspective. As you and Dr. Ware know, I also have sickle cell disease. And so I was a child of the 80s, and I noticed many of these advances happening but when I was, I guess I was too old for them to really impact my early childhood. For instance, when the penicillin trials were going on, I was already past the age that we now recommend it in children. And then fast forward, screening for stroke, that was something that never occurred to me. And so I always am grateful when I take care of the kids that we have in our center, that I'm actually able to offer them interventions from the beginning of their childhood. As soon as they're born, we can start interventions. So I'm excited about that. And the fact that these new therapies are being now studied in children is also a wonderful thing.
So tell us, how are you using these new advances in your practice? How's that affecting your day-to-day clinical life?
So sickle cell disease had a turning point when in 2014, we have sickle cell guidelines that were brought by the NIH. And in those guidelines, it kind of gave a standardized care plan. We started to think of sickle cell disease as a chronic disease even more fully, something that you don't just think of a one-time Band-Aid treatment, but something that prepares a person for their whole lifespan. And so I'm able to communicate that from day one. When we meet a family with a new baby that has sickle cell disease, we're able to tell them that, hey, we have a chronic care plan for your child, and it starts right now. We're able to provide things that prevent illness from infections in children. And then hydroxyurea was absolutely a miracle and a game changer. I actually didn't start hydroxyurea until I was an adult. I'm so happy that I can start it in children, as young as babies even, and to allow them to already start thriving and doing well with their sickle cell disease. So I feel that instead of a chronic disease where you shrug your shoulders and you don't have anything to offer, we now have a point in time that we can say, hey, here's a care plan, we have things to offer. As Dr. Ware said earlier, we have a long way to go. We still need to work on protecting the organs with a person with sickle cell disease, and especially when they get to adulthood, but we are a much better place.
Well, that's great. And Dr. Ware, I know you know about hydroxyurea, but tell us how it's affecting your daily life. You said that it wasn't even available for kids until much later than for adults.
Well, I want to first agree with what we just heard. It's so encouraging now to be able to talk to families and have a comprehensive plan for care as opposed to just an intervention. I'm old enough to have been trained in the 80s and 90s where we essentially watched the natural history of sickle cell disease unfold, and it was a terrible thing. We had to wait and react. We knew what to look for, but we couldn't do anything about it. And that has changed dramatically. And so at a level of being able to do something about it, it's so much more gratifying as a physician and a clinician to have that conversation. We've changed from meeting new families and having a very somber, sobering interaction to having a cautiously optimistic one, where we can talk to families and say, we know about this disease, we know what we can offer, and we have a lot of good things coming down the pipeline. So it's really changed our whole approach to taking care of children and families with sickle cell disease.
And I can say I am optimistic about adult care as well. As an adult provider, I have drugs to offer. I have disease halting therapies that I can alter them, not just modifying therapies. And this is an exciting time. Dr. Fashipe, we're part of a new generation, especially you. Some of us are older new generation people. But ASH is coming up with yet another generational encouragement to get people to see sickle cell disease as an attractive career and to do classical hematology. This fellowship program to recruit the next generation. So say a few things to our listeners about that and what it's like working in an environment like that. And what would you tell people to get them to take ASH up on their offer?
Well, I will do my best to not get carried away with this answer because I'm just so excited that this opportunity has now been unfolding for our for our new generation. So you already heard a little bit of my story. I'm biased. I've always loved sickle cell disease as a disease. It's fascinating. And so when I was a resident and I knew for sure that I wanted to go into hematology oncology, I was an outlier initially. I had several other co-residents that wanted to do oncology as well, but it was the oncology part that fascinated them. So I started just kind of comparing the two. What would it mean if I entered hematology oncology and focused more on the hematology? And for me, especially sickle cell disease, I was fortunate to have had my training at Cincinnati Children's actually. And the mentors there in hematology, they were just so wonderful. You know, they showed me that sickle cell is a very complicated disease, which makes it very fascinating and interesting to study. There's always something new to learn with it. I learned something today. I kid you not, I got an email today that educated me about sickle cell disease yet again. That happens all the time. I'm always challenged in the most positive of ways. And then even when it's hard, when you're dealing with a difficult patient situation, the fact that I have a community of experts around me that I can go to and talk to about how to make life better for a person, it gives me so much, I don't know how to explain how much joy it gives me compared to when I think about when I was receiving my own care growing up. We need more hematologists. That's just the bottom line. But it's not that it's not that the diseases that hematology follows are not interesting or important. I think they're hidden. We're more knowledgeable about some of the other diseases in oncology because most people are familiar with cancer. Blood disorders have a more chronic disease component to them. So for those people that are interested in studying chronic diseases, you want that continuity of care with your patient, somebody that will stay with you, throughout that lifespan. You're able to impact life positively, not just for the patient, but for their families. This is the field that really brings all of that together. And you're also in a field where exciting things are happening all the time. There's always something new being uncovered. So I am so grateful to the American Society of Hematology for starting this fellowship program to allow people to have their eyes opened to this wonderful world that I've grown to love, not just from having it myself, but now understanding the disease more fully as a doctor.
Dr. Ware, I know that you agree with that. Tell us about your perspective. Here you are having helped create this environment.
Well, just to comment on the ASH award, I think it's a wonderful, bold, visible move by ASH, but it's really only one in a string of support. They have had support from medical students to residents to fellows, Clinical Research Training Institute, and so on, always having hematology as part of that portfolio. So it's a great thing and it is needed, but it's just the latest installment. I think a career in classical hematology is the best around because there's something for the physician clinician in us. There's plenty of science, there's academia, there's mentoring and education. And now, if you're interested in advocacy and activism and equity, it's there too. You really can get a very fulfilling full career in hematology. And I would just encourage people who are in the early stages of their training to find mentors and see how good it is, because it really is a great thing.
Yeah, the Nobel Prize, the invention of the term molecular disease, the understanding of monogenetic single nucleotide change and how the impact of that, you have to understand genetics, you have to understand biochemistry, you have to understand physiology, you have to understand epidemiology, you have to understand sociology, you have to understand all these ologies these days just to understand sickle cell disease. Osler said, to know syphilis is to know medicine. And I now go around saying to know sickle cell disease is to know medicine. So Dr. Ware, there's a lot of opportunities, right? In the United States, and then globally, there's an opportunity to spread this knowledge and make an impact in places where sickle cell disease is endemic. Talk to us about some of those opportunities.
Well, when I was in training, I naively thought of sickle cell as something that occurred in the United States. I didn't know about the world global burden. And it took a while for that to become apparent to us all about how much disease there was worldwide. But now we know that it is a global burden, it is a global disease, it needs global solutions. And so here we are now with support from every angle of government, foundations, global health groups. There's a lot that's happening at the international level. You know, I think we can now get involved as much as we want to at the international level, whether it's something as simple as diagnostics or the epidemiology of surveillance or treatment or implementation science. I mean, talk about an opportunity to do mentoring and to have a fulfilling career, to have an interaction with clinicians and scientists in low resource settings and be able to make an impact. It's very fulfilling and has been a great part of my career as well. So it's exciting, Wally.
I'm excited. And Dr. Rashipe, you have a unique global vantage point to talk about sickle cell disease. I'm just going to let you go. Tell us.
So, Dr. Smith, I get emotional when I hear people like Dr. Ware speak, and just again to know that we've come so far. I was born in Nigeria, and I came to the United States when I was a young child. My parents immediately took me to the closest children's hospital and asked them, what do we do for our child with sickle cell disease? We're in America. America has the high-tech medicine. What do we do? And they sadly told her, we don't do anything different than what is happening in your home country. That was when I was 3 years old. Fast forward, I was a middle school age child. I went back to Nigeria and spent some years there going to school and living with my family. And I met my first other person who had sickle cell disease in my family, a cousin of mine, and loved her so much. This young woman passed away at the age of 17 years old. And I was convinced it was because we were in our home country, Nigeria, that we just didn't have, the right technology to help her, that if only she had been in a different place, maybe she would have had better care. It's a naive view because I actually didn't understand the complexities of the disease at that time. My suspicion is that she had one of the more severe complications of sickle cell disease called acute chest syndrome. But the fact that she didn't have access to life-saving therapy pained me. And that was actually my true inspiration for joining this career, one of the first initial triggers. So now I have a network of friends and colleagues and acquaintances in Nigeria and other sub-Saharan countries that are impacted by sickle cell disease. And the conversations we have are different. Hydroxyurea is known now. That was not a thing to say, oh, hey, let me get hydroxyurea in Nigeria or my home country. That was not a thing. We still have a ways to go. The reason why I get emotional is because when people get the fact that though sickle cell disease is very important in the United States, the true global burden lies elsewhere, and they are investing their lives and careers to impact the disease. I just have the utmost respect and gratitude because it means that we're saving lives. There are children that are now getting newborn screens. There are children that are now being placed on hydroxyurea. There are children that are now getting better standard care for sickle cell disease. I still talk to families that don't know about hydroxyurea and they're looking for all sorts of options for their children. And I'm just so happy I can now share some things with them to get them started. When with sickle cell, there's always this go big, go home feeling about it. It's like, let's save the world. But I think we actually are doing the right steps towards that. I really do. And I think we're going to see a new generation of people that lived because of the disease and did not die prematurely like my cousin, but were able to extend their lifespan and actually have an enjoyable quality of life, regardless of where they live in this world. So World Sickle Cell Disease Day just means so much because I reflect on all of these aspects of caring for the disease. And I'm happy that we have people like Dr. Ware going out there and kind of getting the work done. So thank you.
We are definitely celebrating life today, extended life, bringing sickle cell disease to life has many meanings. And, one of the things I was just thinking about is the future, right? We have so many initiatives now that ASH has started related to sickle cell disease. And, got the coalition, and we have a workforce initiative, and we've got guidelines, and we have people meeting needs in Africa as well as in the United States. Talk to us about the future, Dr. Fishipe. Where are we headed?
So another part of my career, as Dr. Ware said, hematology has become so eclectic now. I am an advocate. I've been in the role of advocacy, community work, and as an advocate, I've had the privilege of speaking to many sickle cell support groups. And every year I give a talk about sickle cell disease and, the future. And I remember the first time I gave the talk, I had the Mariner's Tale poem, water, water everywhere, but not a drop to drink. Well, and I kept on thinking, sickle cell therapies everywhere. Which one's right for me? Like for me, it was like, I see it, but I can't touch it. I can't drink that water yet. But then a year after, just 1 year later, I gave the talk again, and I decided to use more of a hope quote. I have hope, and I continue to have hope, because I can now touch that water. I can now feel it, that we are making a difference with sickle cell disease. And the fact that we can do it both here nationally in the United States and also abroad in other countries, it just makes me so happy. I would love to see people join us in these efforts. I'm excited by the fellows that I work with now that chose careers in hematology and are excited about the challenges and the opportunities that it brings. And so the future is bright. The future is still important to respect the historical component of sickle cell disease, because I do feel like if you don't respect that history, we might make mistakes in regards to helping the future. And so I want to see us continue to use our history to kind of educate ourselves on how to impact the future the best for the individuals, these precious, sweet souls that have sickle cell disease, and that we can continue to do all we can for them. So yeah, I'm hopeful. I am very hopeful.
And I am too. And I know Dr. Ware is. You get the final say, Dr. Ware.
Well, it's hard to follow those great quotes. I'm hopeful, but I'm actually optimistic. And I'm optimistic because we now are providing care and options and hope for children born with sickle cell wherever they are born in the world. And that we could never have said a generation ago. And I hope it only gets better. I want to put one last thought about cures. We talk about if we only had a cure for sickle cell. Well, we have had cures for 40 years through transplant, and yet they don't always get activated. I want us to not forget to take care of the patients, even if there isn't an easy cure right away. We have ways to help manage and improve lives and make the quality of life better for patients and their families, and we can do that now. So I don't want people to only look to the far distant future for the cure and lament that we don't have an easy cure for everybody. We can do a lot, and we are doing a lot. So I remain optimistic and hopeful.
We are bringing sickle cell disease to life, and I mean that. Can you feel it? I hope you can feel that. I hope everybody can sense our excitement, our enthusiasm, and our hope based on evidence. The lifespan for patients with sickle cell disease is continuing to improve. So that wraps it up for us today. Drs. Ware, Dr. Fishipe, thank you for joining me. And thanks to all of you who've joined us. We just skimmed the surface today, but there's a lot more to talk about. I want to remind you, we've got a podcast series coming called Bringing Sickle Cell Disease to Life. Please visit the ASH website to learn more about what ASH is doing and how you can get involved. And be sure to keep an eye on the ASH social media for the podcast. Thanks for being with us today.